Good morning and welcome to this presentation. My name is David Mulama, a student at ECPI University. The topic of my presentation today is challenges encountered by nurses in wound documentation during patient admission. Before we delve further into the presentation, I would like to acknowledge the following individuals. First, I would like to acknowledge the main role played by my mentor, Dylan Baker. Two, Courtney Rep, who is the unit manager. And lastly, I'd like to acknowledge my fellow nurses on the floor. And lastly, my family that provided moral and financial support for the process. My topic is on wounds documentation. And so we need to understand what is a wound. A wound is any breakup in the skin integrity. This can be through a cut, can be through a burn, can be through surgery, can be through trauma. The skin is the important organ when it comes to covering the whole body of the human being and acts as the first line of defense. And therefore, a wound compromises the immunity of the host because it provides the portal of entry of microorganisms into the host. For this reason, we need to document the skin integrity for every patient that is admitted on the floor. This is important because one, it establishes the baseline for treatment and continuity of care, and two, it demonstrates medical necessity that the provider has to attend to. It also supports billing and reimbursement, and it protects against legal risks. And lastly, it's the law for regulatory compliance. Given the above reasons for wound documentation, what was the scenario on the floor? What I'll call the unit wound SBA. One of the things I noted was there was inconsistent documentation. In fact, there were some wounds that would be discovered when the patient was being discharged. Most of the records were incomplete, and there was variation in the terminologies used by different nurses. For this reason, to address this particular problem, we designed the current project. This particular project, the main goal was to identify the challenges that nurses faced in wound documentation and propose strategies to improve the consistency and accuracy of wound documentation. We had the following specific objectives. The first one was to name and explain at least 3 nurse-specific challenges. 2 was to name and explain any 3 patient-specific challenges. 3 was to identify and describe any technology and language-specific challenges. And then from all this, we were to identify at least 3 strategies that can be employed to improve wound documentation. This study, therefore, had the following outcomes. The first outcome was to test the knowledge of the nurses on the floor. To do this, there was a pre-training wound assessment where the registered nurses scored a mean score of 93.9%, followed by the licensed practical nurses who scored 62.25%, and the least performing were the certified nursing assistant who had a mean score of 41%. We organized a training session where all the nursing staff were given information on wounds, on wound documentation, wound assessment, wound measurement. And after this particular training, they were also given a post-training assessment. I can report that there was tremendous improvement where the certified nursing assistants moved from 41% to 78%. The licensed practical nurses moved from 62% to 87.5%, while the registered nurses moved from 93% to 97%. The second outcome from this project was a summative report that we presented to the unit. In this particular report, we identified three areas that needed to be addressed as some of the challenges nurses faced. First of all, it was the characteristic of the nurses. Nurses complained that they lacked the skills, they lacked the terminology, and they had also increased workload, which impeded their ability to accurately and consistently document wounds. The second challenge was technology and the medical terms. The nurses felt that they were not conversant with the current technology that we use to capture medical photos, and even the language was not consistent or uniform from one nurse to the other. Lastly, they pointed out the patient dynamics, where patients were non-cooperative, and thus patient needed education or ways of information to allow nurses to document wounds accurately. From this particular summative report that was over the unit, the management were able to get the views of the staff, and this led to more appreciation of the role and function of the nursing staff. The other outcome was the implementation of 2 nurses documenting a new wound or wounds or doing assessment on a new patient on the floor. This led to improved and consistent documentation, and nurses felt more appreciated. There was also improved teamwork, collaboration, and quality of work on the floor. What about the outcomes to the unit? My project led to the implementation of 2 nurses doing wound assessment for every new admit on the floor. Because overload was one of the challenges the nurses faced, the unit manager was tasked with the responsibility of hiring new staff and allowed more training of staff. She also promised to increase the remuneration of the staff so that to motivate them to accurately do the wound documentation. This particular project also led to the setting up of the wound team, whose main function was to ensure that wounds are accurately and consistently documented. And there was improved job satisfaction as well as regulatory compliance. How will this information be important to me as a nurse? This project initiated me into leadership position where I was in charge of this particular project, and 2, it also showed me what mentoring is and also led to improved quality. It taught me that I could teach both in person as well as e-learning. It enabled me to perform project design, implementation, and execution. And lastly, throughout the whole project, I was able to write a report. I was able to disseminate the information as what I'm doing right now, as well as publication. For my future lifelong learning and career and practice, this project was very important in leadership and collaboration. It is very important for teamwork and communication, where I was able to work with different nurses and communicate my project to them. It was also important for improving my project management competencies and also for clinical skills, where I learned a lot about wounds and evidence-based practice in management of wounds. I want to say thank you so much. It has been a pleasure presenting this project to you.